Hi, my name is Tine Jensen. I'm a clinical psychologist and also a professor at the Department of Psychology at the University of Oslo, Norway. So how can we understand and support traumatized children? And what can we do? In this talk, I will first review some of the common responses to trauma that children may have, and then I will talk a bit about what we as professionals and other adults can do to help these children. When we talk about trauma, we often talk about two things. We speak of trauma as an event or a series of events. We can say he or she experienced a trauma, such as being abused, or experiencing something war-related, such as seeing someone be killed. Other times we talk about trauma as the consequences of these experiences. He or she was traumatized by seeing his father being beat up, for instance. Responses to events are very individual, so one thing that may have a large impact on one person may not have such an impact on another person. Therefore, we often talk about potentially traumatizing events. And when we do talk about potentially traumatizing events, we are talking about events that are extremely threatening or horrific. This can be things the child has witnessed, such as someone else being beaten up or killed, or it could be something the child has experienced themselves, such as sexual abuse, violence in the home, or serious accidents. For children, the sudden loss or separation of a parent may also be referred to as a potentially traumatizing event. It's important to bear in mind that the responses to such extremely threatening or horrific events can vary depending on the level of exposure and also according to the child's personal and social resources. In fact, many children will recover slowly when the threat has ceased and they feel safe again, and also with adequate social support. Therefore, one should always keep in mind and have individual assessments when providing help. For this, we need to be aware of some of the common reactions to potentially traumatizing events, which can be described as changes in how we feel, think, and behave. So, how does trauma affect children? It affects how they feel. First of all, traumatized children have often lost a sense of safety, and they may go around feeling scared and think that bad things can happen again at any time. This, of course, causes a lot of internal stress, and they may feel hypervigilant. Many children are also angry. They feel that what happened is unfair. They didn't do anything to deserve what happened to them, their family, or their friends. Children may also feel sad, particularly if they lost a family member or even lost their home. They may feel that things will never be the same again, and they may start to feel emotionally distanced from other people. Children have often also an egocentric view of the world that leave them to take responsibility for things. This can lead to feelings of guilt. They may feel that they should have intervened to stop something from happening, even though they could not possibly do anything different. And importantly, they may feel shame. They may have experienced something humiliating or embarrassing, or feel that they have done something wrong, immoral, or dishonorable. Children also may change their way of thinking. They may not longer think the world is safe. They may not think that others are trustworthy, and they may start thinking that they are not worthy of a good life. We call these maladaptive thoughts, and even though there may be some truth to them, they are often exaggerated and they are not helpful. In fact, several studies have shown that maladaptive thoughts contribute to the maintenance of post-trauma symptoms. Typical maladaptive thoughts are, the world is a scary place, bad things can happen at any time, no one can ever be trusted, I will never be the same. It's my fault. I'm a bad person. And we can see how such thoughts can contribute to negative feelings of oneself and the world. Trauma also affects how children behave, such as they can start avoiding people and places that remind them of what happened. They may start hurting themselves by eating too much or too little. They may start cutting themselves. They may have problems concentrating and having school problems. We also see sleep disturbances such as nightmares or trouble falling asleep. Older children may start using alcohol or drugs to feel better. Younger children may go back in their development. They may start wetting their bed, cling to their parents, and also they may seem very dysregulated. Even though these responses to trauma are common and normal reactions to horrible events, it's easy to understand that these affective, cognitive, and behavioral changes can be hard for parents to handle. They may feel that their child has changed, that their regular ways of parenting their child is not helpful anymore, and they may worry about the future. One important part of interventions after trauma is therefore to provide parental support, and many children will fare well with good parental and social support from family and also from teachers in school and the community. Many of these problems or symptoms that I have mentioned are expected shortly after trauma. The intensity of these may slowly decline in a natural course as the child starts to feel safe again. The child may not need so many therapeutic interventions in the acute phase, but symptoms should be monitored. If symptoms do not decline, or if they do increase, therapeutic interventions should be considered. Exposure to traumatic stressors is not only accountable for the onset of post-traumatic stress, but also for depression and anxiety. Particularly PTSD, or post-traumatic stress disorder, seems important to monitor, as a review of longitudinal studies of PTSD in children shows that there was little change in symptom reduction after 6 months, and it is therefore likely that PTSD may become chronic without treatment. So what is PTSD? According to the ICD-11 diagnosis of PTSD, PTSD consists of 3 symptom clusters: re-experiencing the trauma, avoidance of trauma reminders, and a heightened sense of threat. The new disorder of complex PTSD is a sibling disorder and consists of the 3 PTSD clusters that I just mentioned, plus what is called disturbances in self-organization. And this includes emotional dysregulation, interpersonal difficulties, and negative self-concept. You can see closely the link to the normal responses to trauma that I have reviewed, and it is when these symptoms become lasting over time and when they cause impairment in functioning that we can diagnose PTSD. And depending on the event, it's estimated that approximately 15% of youth that do experience trauma develop PTSD. The complex PTSD concept is so new that we do not have estimates for this in children yet. Since many children recover, researchers and clinicians have tried to understand what maintains post-traumatic stress. According to one common theory that has gained support in several adult and child studies, post-traumatic stress is thought to be maintained through 3 processes. One is related to the way memories of frightening events are stored in our brains as fragmented and sensory-based, so that they are easily triggered by things that remind the person of the events or series of events. Implications for treatment are that the trauma memories need to be elaborated and processed. The second is the individual meaning the person develops regarding the trauma and their own responses afterwards. Children may, for instance, think negatively about how they reacted during the trauma and feel incompetent and vulnerable for new traumas, or they may feel ashamed. They may also interpret their own responses in the aftermath of trauma as indicators that they're crazy, weak, or permanently damaged. Assessing the appraisals is therefore an important step in treatment so that these can be changed, challenged, and ultimately altered. And lastly, within this theory, these symptoms and appraisals bring with them a current sense of threat or discomfort that may lead to a range of maladaptive coping strategies, such as avoidance, being on the alert for danger, or self-medication strategies, as I mentioned before. So then the question is, what can we do? The overall aim is to help regulate their feelings, challenge their ways of thinking, provide better coping strategies, and help them talk about what happened. And this will help them build coherent narratives that is meaningful for themselves and that can be communicated to others. So how can we do this? Well, first we need to provide information. We often forget how important information is, even for young children. They may have overheard some adult conversations that are confusing to them. Without information, they may start to fill in the blanks themselves, perhaps fantasizing a much worse scenario than what actually happened. It can also be helpful for them to hear about normal reactions to stress. It can be okay to start by asking them if they have any questions or worries or concerns. If you don't know the answer, it's okay to say so. It's important to be truthful. If the child discovers lies, this may reinforce thoughts that adults cannot be trusted. However, be mindful of the child's age and capacity to understand, because they may not need to know too many details that are scary that they have not asked about. It's also important to feel hope, even in the midst of hardship. This may be hard for helpers and parents to provide, but merely reminding the child that they are safe, if they indeed are safe, that others are helping, doctors, politicians, organizations, people throughout the world are thinking of them, reminding them of all the things they themselves can do to help others, perhaps. These things may give them a sense of mastery. Also, in a chaotic situation, it can be helpful to have some routines to lean on. Going to bed and getting up at the same time. If possible, going to school and doing schoolwork is important. This can actually help children to feel some predictability in an unpredictable situation and help them gain control over their lives. Sometimes adults feel sorry for children that are traumatized, and they let them break rules, escape from having chores and responsibilities. But this may actually be counterproductive and may make the child feel that they are not normal anymore. Also, promoting positive activities such as helping others, keeping in contact with friends, being physically active may also be very helpful and counteract depressive thoughts. So although maintaining daily structure and facilitating activities may seem trivial, it can actually be very therapeutic. Many traumatized youth feel very stressed inside. This can lead to sleep difficulties, pain, headaches, stomach aches, etc. It can therefore be very helpful for them to learn how to relax their bodies, teaching them breathing exercises, relaxing muscles, thinking of a safe place. You can start by asking them what they normally do that helps them feel relaxed. Many youth like to, for instance, listen to music, read, or simply being with others. That can be relaxing for them. It can be helpful to help children talk about and recognize feelings, help them label feelings, and we need to validate these feelings, even ones that are hard to accept, such as anger and the wish to retaliate. What can they do to feel better? Through this, we are not only validating the youth's or the child's feelings and thoughts, but we teach them how to cope and manage with these thoughts. It can also be helpful to teach the child that thoughts and feelings and behaviors are interconnected, that one way of feeling better is to think differently. Thinking that I am safe, I coped well, I was brave, my mom is helping me, everyone is thinking of us, may be more helpful thoughts than thoughts of self-blame and that the world is unsafe. Children do not only need emotional support, they need interpretational support. And by this I mean that they need help for how to interpret and make meaning out of the situation. Ask them what they're thinking. Are these thoughts helpful? Are they true? Is there other ways of thinking of this? It may be helpful to help them adjust their thoughts a bit. Although it may be true that everyone is not to be trusted in the situation they're in, who can they trust? Maybe this is a very important conversation to have, that not only will help them think differently, but may also help them be safe. Some experiences may have gotten stuck on the child's mind and on their body, causing, for instance, stress, rumination, and re-experiencing. Re-experiencing the traumatic event is not the same as just thinking of what happened, but it is as if it's happening again, right now. This, of course, is very frightening. Talking about what has happened can help them construct a coherent narrative in a way that helps them place their experience in the past. So talking may be one way to place the experience in time and place so that they can recognize that talking about it is simply just thinking about what happened and not having it happen again. Also, talking about the experience to someone you trust is also a way of receiving acknowledgement and recognition. And it's a way of showing the child that you care about them and that you care about what happened to them. Lack of social support is shown to be a risk factor for negative trajectories after trauma. Lack of social support is shown to be a risk factor for negative trajectories after a trauma. It may be therefore helpful to identify the child's social network. If there is lack of support, see if there is some support that can be built on and strengthened. Studies have also shown that it's not helpful just to have social support. You have to actually use it. And one common barrier to receiving social support is when the child does not want to burden another person because they think that they have enough problems on their own. It may be therefore important to check out if the child, for instance, is worried about their parents and whether they are trying to help their parents by hiding their feelings and thoughts and therefore not seeking support. Parents are children's strongest support after trauma. However, many times the parent is not able to provide support because of their own suffering. In these cases, it's important for therapists or others, helpers, to strengthen the parental system. Perhaps the same skills you are teaching the child will help the parent. Learning how to cope with negative thoughts and feelings, learning stress reduction techniques, providing information may be one way of helping parents to help their child. The metaphor from the flight attendants when they say, if you have children on board, take the oxygen mask on yourself first, applies as a good reminder that a parent who cannot manage their own fears cannot either help their own child manage their fears. Many of the helping elements that I have mentioned can be helpful not only for practitioners, but also for parents and teachers as well. Children who do not respond well after some time may need more help and may need therapy. Many treatments have the same elements in them. Here, for instance, are the components in trauma-focused cognitive behavioral therapy, which is the treatment of choice for children who have experienced trauma and have elevated post-trauma symptoms. You will recognize many of the same elements I just have mentioned, and they go under the acronym PRACTICE. It's psychoeducation, teaching parenting skills, relaxation, affect regulation, cognitive coping, trauma narrative and cognitive processing, in vivo exposure, and enhancing future safety and consolidation. The first components here, in short, are about teaching skills so that the child can cope and manage their own stress when facing trauma reminders, so that they are able to further process their trauma history. The parent has an important role throughout the treatment. The next components are more about processing the trauma. When the child has enough skills to handle elevated stress, we can talk about the trauma in ways where we go into more details and also talk about the worst hotspots. Cognitive dysfunctional thoughts are also identified and processed. And we ensure that the child can recognize risky situations so that they can be safe in the future. At last, I want to stress the importance of resilience. Many children are very resilient, and they do not need therapy, but they need supportive adults. It's important that our helping strategies build on the child's strengths. Many can feel, for instance, a relief that they're safe. They can be proud of what they have achieved, what their family has done to protect them. They can be proud of their country. We can build and strengthen existing coping strategies so that they can help themselves when stressed. And importantly, help needs to build on existing resources in the child, the family, and in the community. Thank you for your attention.